All over the country, people are struggling a lot and really need a lot more support, a lot more attention for this horrible conflict and also humanitarian crisis. My name is Marcella Kraaij. I just came out of Sudan. I've been there for the last 2 months as a head of mission for MSF. So Sudan is a very big country. To the west you have Darfur, and then in the middle of the country you have Khartoum, and you also have across the river Nile you have Omdurman, which is a city of about 1 million people. And MSF has a project there, and I was there for some time. And while I was there, I saw and I met our amazing Sudanese staff who've actually been working there under fire, literally, for the past year. Even while I was there, we could hear the outgoing shelling every day, very noisy and intimidating. And then there were also moments of silence, which are almost more scary, because those are the moments where you have incoming shellings. And from my point of view, really, Sudan and the Sudanese people deserve a lot more attention. And it's our obligation to talk about what's happening in Sudan and to act. Organizations are not present, and that includes even MSF. We're present in much of the country, but those are individual places. It's not like we're covering really all the needs that are definitely there. One of the big challenges is the security situation. Shelling is something that you hear every day, that's going on all the time. Shooting is also not uncommon. We see, people wounded by shell casings, by gunshots every day in our hospital. But besides that, there's also what I call the paper barrier, which means that it's not easy as an organization to get the appropriate permits to be able to move around and get to the people. People are really struggling to access healthcare. Big parts of the city are pretty much no-go areas anyway. What's also clear is that in some of our hospitals, some of the patients we see are coming from far away. It's again an indicator of how difficult it is for people to even access any healthcare at all, that they're able and willing, through many difficulties undoubtedly, to travel sometimes hundreds of kilometers just to be able to get to the facility to get any healthcare at all. It also means that a lot of the patients coming are actually coming late. They're presenting later than they should, and their health situation is worse than it needs to be. For malnutrition, it's clear that the numbers are increasing. In the children's hospital that we support as MSF in Omdurman, access to food is already difficult. This is like even before the children getting malnourished. The prices have skyrocketed so much, and the population has had so much financial trouble that many people just plain can't afford to buy the food that's there. And then you have to imagine some of the areas that are harder to get to, more in the desert, more like far away. So we're really expecting a worse situation than we already see when it comes to malnutrition in the coming period. What we see with the shelling is that basically the two warring parties are shelling at each other across the River Nile, but really those are big cities. There are a lot of people living there. And so it means that it's the people living in those places, normal people like you and I, that are getting these shells on their heads, on their houses. And so I would really hope that one day the warring parties see that it's the civilian population that's suffering the most.